Has life thrown you a curveball and strucken you out? Congestive heart failure is a term used to describe a heart that can no longer keep up with its workload. The body is not getting the oxygen it needs, adding extra strength and fatigue, and also depleting strength. As oxygen rich blood being pumped out the left ventricle slows down, the oxygen depleted blood returning through the veins is also slowed down and backed up. This will cause the heart to increase the pulse. And being a muscle, the heart will also increase in size and demand for the demand of more blood. These are all temporary measures and fixes to a more serious condition. The overcompensation of the heart will worsen the condition of the failure. Veins and arteries will then become narrow to increase blood pressure. The retention and congestion of blood also affects the rest of the body. This will affect the kidneys' function in disposing of water and sodium. The retention also leads to an increase of blood in the circulatory system. The lungs are one of these sites. A retention of fluids will cause swelling and collection of fluids that interfere with breathing, causing shortness of breath and fatigue. This will cause an inability to exercise or restriction of an active lifestyle. The limitation of blood circulation throughout the muscles will decrease the strength output, adding even more strength to the heart that is already under stress. There are no oral manifestations associated with congestive heart failure. However, the usage of digoxin may cause xerostomia. Digoxin's mechanism of activation works in increasing the levels of calcium through the heart's myocyte cells. It does this by binding to the sodium-potassium ATP-phase pump, and in doing so, blocks the potassium from entering the cardiac myocyte cell. This process also prohibits sodium from leaving the cells. There will be more sodium inside the cardiac cells. This process will lead to the inactivation of the sodium-calcium exchange and also prevents the release of calcium out from the cardiac myocyte cells. The influx of calcium ions will increase the force of the heart and cause a more powerful contraction. This will improve the ability of the heart to pump blood more efficiently. Absorption of digoxin is done at the small intestine with an oral administration absorbed at a percent of 60 to 80. It may also be administered through IV. The onset of action is around 15 to 30 minutes after oral administration, with the duration of action being 2 to 6 days. Digoxin binds a protein plasma at a rate of 25%. This gives digoxin a high volume of distribution throughout the body, not just at the heart. Metabolism is partially done in the liver, and most of it is done in the small intestine, with the plasma half-life of elimination being around 25 to 45 hours. It is excreted primarily by the kidneys and mostly unchanged in the urine. Any impaired kidney or renal function will increase the half-life of digoxin. Digoxin will have an interaction with Zentromax, better known as Z-Pak. The combination of the two will increase the levels of digoxin, therefore increasing the toxicity levels of digoxin. Some side effects and symptoms include nausea, upset stomach, and vomiting. Another drug interaction is with Motac, which is used for atrial fibrillation. Taking these together will increase the drug toxicity level of digoxin. The combination of the two may cause new or increased heart rhythm problems. Digoxin has a major interaction with calcium channel blockers. This includes verapamil, which is used to treat high blood pressure. The combination of the two may slow the heart rate down too much, which may lead to bradycardia when taken together. Some serious adverse effects to look out for are bradycardia, also irregular heartbeat. The feeling of lightheadedness, confusion, or dizziness are all symptoms to alert a medical professional. Digoxin toxicity, which can cause nausea, diarrhea, and vomiting.
If you experience swelling of the face, lips, or tongue, skin rash, or hives, please seek immediate medical attention due to allergic reactions.
When taken as prescribed, digoxin can help manage various cardiac conditions due to its ability to increase myocardial contractility and regulate heart rate. Please refer any further questions to your primary care physician.